So for up next, we're trying to look at what a prolotherapy is. We're trying to look at what a prolotherapy is. So what is a prolotherapy? So from my little understanding of a prolotherapy is, you are trying to kind of like inject, probably an anti-inflammatory drug, right there into the joint or a muscle, okay, or ligament. Of course, it will act on the muscles, ligaments in the joint, So prolotherapy is just a short therapy for proliferation therapy. It's an injection-based alternative therapy. This one is basically for those plantar fasciitis, okay. So it's aimed at reducing pain and promoting tissue repair in different musculoskeletal conditions. So it involves injecting an irritant solution. Commonly, they use the hypertonic dextrose. That's why I have it here, dextrose injection. So they inject it into ligament, tendons, and joints. The idea is that the irritant triggers a mild inflammatory response, which in theory, it will stimulate the body to heal faster. Do you understand? So what are the uses? You might use it on patients that have disease conditions like arthritis, chronic low back pains, tendinopathies like inflammation of tendons in different parts of the body, degenerative disc diseases, fibromyalgia. Okay, so that's what we got. Evidence and effectiveness is research findings are mixed and inconclusive. Some studies support it, while some studies say that there's no really more benefits. Do you understand? So this one is basically for that hallux rigidus. Okay, then systemic reviews highlight tentative evidence for conditions like knee osteoarthritis, lateral epicondylitis, but lower back pain results are inconsistent. For another patient it works, for another patient it doesn't work. So that's what we got. So risks and side effects is prolotherapy is generally what's considered good, but sometimes you can have some pain at the injection site. Probably maybe the injection wasn't given right. You can injure some internal structures. You can have mild bleedings and bruise. So these things are not things, they are not risks that outweigh the benefits. Okay, so it's actually an accepted practice. So this is what prolotherapy is.